Well, good afternoon. It's such a pleasure to be here, and this is at the very beginning of our homestretch push on the vaccine front in the Etobicoke, Rexdale, York area of the city, where we have some challenges to overcome, but we have a great opportunity in front of us as well in terms of just getting us that extra bit of the way there to people being fully vaccinated. Before we begin to talk about the program that's going to take place over the next week or so in the York, Etobicoke, Rexdale area, I wanted to comment on the provincial government's announcement on Step 3 that came earlier today. This is good news, and I'm in full support of this cautious and balanced approach, based as it is on data and based on the advice of our medical professionals. Businesses have told us they need guidance as well on reopening, and they got a lot of that guidance today. It's been some time coming, but now we know, they know, more importantly than whether we know, the circumstances, the conditions under which they will be operating. And a lot of them just want to get back into business, but they had to know what the rules of the game were, and I welcome the fact that that has been made public today. We will work with individual businesses and with the province to make sure that these new guidelines are implemented in the easiest way possible for these businesses and all the people who work for these businesses as they get back open or open further up compared to where they've been in the coming weeks. And that, of course, will happen next week. I do want to say this, though, and it's very, very important. We have talked all the way through, whether it's the Premier, whether it's the medical officers of health, myself as the Mayor, Councillor Cressy and others, Councillor Ford who's here, we've talked about the need for a balanced and cautious approach to make sure that as much as we make progress, and we've made a lot, that we also don't run a risk of sliding backwards. And so that kind of caution, that kind of attention to making sure that we know we're coming out of a very dark period, but it takes a while to come out of it completely, is going to be as necessary in the coming weeks as it has been in the past. Over the months of August and September and October, we have people that are doing the right thing and made appointments to book themselves in for their vaccination. And one of the messages that we wanted to deliver today is to say, if you've booked one of those appointments quite far out, because maybe that's all that was available when you did the booking, check again. If you've passed the necessary period between first dose and second dose, we have appointments that are available now that you could take advantage of and get vaccinated sooner, because the single best tool, the single best weapon we have against COVID-19 and against the variants is people getting vaccinated. And I'm going to talk about a few of the numbers there, because it's important to see that we're doing well on the one hand and people have really stepped up. But on the other hand, we have a bit of a gap to make up in order to get us to the point where we can be completely confident that we're going to be open and stay open, and that we're going to be healthy and stay healthy. So I encourage you to really consider very carefully accelerating, speeding up the time that you get vaccinated, so that if you have an appointment out into the distance, I can tell you right now that even just this week alone, there are 16,000 appointments available in the city-run clinics. There are lots of opportunities in the community, like the one that's going to be taking place here in the Albion neighbourhood of the city, and we would urge you to explore opportunities to get vaccinated sooner, because the sooner you get vaccinated, the sooner you are protected, the sooner your family members are protected, the sooner your co-workers are protected. It all helps out a lot. And so I do encourage you to look for the opportunity to speed things up if you possibly can. We also have changed a bit of our own approach in a couple of ways this past week or so, and that has been under the leadership of the Toronto Board of Public Health and its chair, Councillor Joe Cressy, and also our health partners right across the city. And the first change that we made as a city was to provide for the first time for walk-up opportunities at one of our clinics. And we started it at the Toronto Congress Centre just earlier this week. And what we did there was to make 2,000 appointments available every day between 12 noon and 7 at night, so that people could just show up. They didn't have to make an appointment, and if they showed up, we said we would deal with them up to the number 2,000. That has worked well, and so we wanted to try it out and make sure we had the ability to deal with it properly, so that we didn't create problems where there were none. And so I'm very pleased to tell you that based on the success so far, and this is a work in progress so that I'm able to give you an update, based on the success so far, some additional clinics, specifically Cloverdale, the Hangar, which is in North York around Downsview, the Metro Convention Centre, which is downtown, and the Congress Centre, which is the one by the airport that has been doing this already, already having the walk-up appointments. The other ones that I mentioned, again, I'll mention Cloverdale, the Hangar, the Metro Convention Centre, and the Congress Centre. They will now have walk-up appointments in differing numbers, starting as early as tomorrow. And so I would urge you to stay on top of our website at toronto.ca or stay on top of the news, and we will keep you informed, because it's our hope to continue to roll out more of these walk-up appointments to make it easier for you to get vaccinated. Every one of these clinics will have different opportunities, different numbers of doses that are available on a walk-up basis. So if you check on the details, then you'll know that you won't be disappointed. And the whole idea here is to make it easier for people to get vaccinated and to have access to a vaccine as soon as possible. And that's also why we're here today, because today begins a week, a very solid week of intensive effort to make sure that in this York, Etobicoke, Rexdale, a part of the city, that we can put a really keen focus on 6 top priority neighborhoods where we will have, at last count, and it's growing all the time, more than 20 clinics operating over the course of the weekend. And this has been with the encouragement of Councillor Ford, with the leadership of Councillor Cressy and the whole team that has helped out across the city. We brought every single resource to bear that we can, with the view to making it possible for us to get around some things we know exist. One is the question of accessibility. Sometimes, for some people, if things are further away or they're in places they're not familiar with, people are not as inclined to go there. Or even just a thing as simple as having a transit pass or having an Uber ride, which we've been able to provide to some people that need that help. Some people have fears. They have fears about even the whole notion, some people, about getting a needle or about having a particular vaccination of a vaccine that is, relatively new. And other people have issues of trust. Maybe their experience with the healthcare system or with government generally has not been, something that fills them with confidence. And so we've put a program together that is going to address all of those things and make people confident, make them comfortable, make them feel they can trust the people that show up to talk to them about coming to get vaccinated, because we have to convince the people who live in neighborhoods around this area and elsewhere in the city that it is safe, it is important, it is in their best interest, it is in the best interests of the entire city. Just to give you an idea as to why, on a factual basis, this is necessary, for the Etobicoke, York, Rexdale area, the vaccination rate for first dose is 59%, and for second dose is 36%. And so if you compare that to the average across the rest of the city, for first dose, it's 78% across the rest of the city, so you compare that to 59, and that's a big gap there. And that means those people are exposed to COVID-19, and they're exposing themselves and their relatives and their co-workers to having a terrible problem with their health. And if you look at second dose, the number across the rest of the city on average is 56% compared to 36% in the area that we're focused on this weekend. So that tells you why we're doing this. And in addition, right across the whole city, we have a gap that is between, say, the high 50s of people who have a second dose and near 80% that have a first dose, and that gap has to be closed as well, because we need everybody to have their second dose. You are considered fully vaccinated and subject to very high levels of protection if you have both doses, not just one. And I will just take this opportunity to mention again something I mention all the time. I'm not necessarily the person that people are going to take this from the best. It may be better from Dr. Davila, our wonderful medical officer of health, but she has certainly taught me, as have the other experts that we rely on, that any vaccine you have is a good vaccine. It's a safe vaccine. If it's been approved by the government of Canada, then it is safe to be put into your arm. And any combination of vaccines is also safe. For me, I happen to have the AstraZeneca vaccine first on my first dose, and I had the Moderna vaccine second. And I can tell you, I'm coming up on my 2 weeks on this weekend, and it was safe. It had I was a little bit tired on the day after, but that was it. Maybe I was just tired because I've been working too much. I don't know, but I can just tell you there was nothing else that happened, but it did give me that full protection that comes from being vaccinated twice. I will just say to you that all of the efforts we're going to put into the York, Etobicoke, Rexdale area this weekend with the 20-plus clinics and all of the intensive efforts are no commentary on the efforts that have been put in this area to date, because it's a more challenging work. It's being done on a very local, individualized basis, and it takes longer and involves more resources. And so we've had the good fortune to have added to the tremendous efforts made to date under the leadership of the Humber Hospital and other health partners in this part of the city, some other resources we can bring to the table to make sure that we can put every single person to work in this area to get those vaccination numbers up that we can. And so I want to say a particular thank you to Toronto Public Health, because they coordinate a lot of this under the leadership of Dr. Davila and Councillor Cressy. And then also, it's been very important to us that we have the Michael Garron Hospital and the UHN Hospital Network, both of which are in parts of the city that are far away from here, but that really just proves that it's a team effort all the way around. And then, of course, and I'm going to mention some of them in a moment, wonderful, absolutely necessary community health organizations. And the reason I say they're absolutely necessary isn't just about bodies, and it isn't just about, people to be here doing various things. These are people that are known. These are people that are trusted by the people that live in these communities, because they're used to seeing them in all different circumstances. And that's going to increase the opportunity that we have when they're here or when they knock on a door or otherwise encounter people to convince them that it's time to come and get a vaccination. Now, how targeted is this? Well, fortunately, because we've been collecting data from the beginning, right down to the individual person and some of their own demographic characteristics, we know exactly who has been vaccinated and who hasn't. And we know that, for example, if we pointed to any building out on the street and sort of said, what's going on in that building, we could say, well, the rate of vaccination is 43%. And we know, just from all the lists, that there are other people in that building who have not been vaccinated. And we're going to take these wonderful ambassadors who come from these community health organizations, and they're literally going to go and knock on a door or go to the lobby and meet people there, or go to the local, points of interest, even going, in some cases, I know they've been distributing flyers in places where people get food or otherwise shop, and make sure they know that they can get vaccinated. And, of course, the clinics are being located in the lobbies of buildings, or in a basketball court nearby, or in an arena like this, places where people are familiar coming to, and so they'll feel comfortable coming to get vaccinated. And so that's a part of how we're dealing with the accessibility, with the fear, and with the trust issues that are out there just for us to deal with, because that's part of the challenge that we face. And as a city as a whole, the reason it's a team effort is because we are all in this together. And we've got to get all of our efforts up to make sure that the city as a whole can be healthy, no one left behind. Absolutely no one left behind. Before I conclude, I want to thank some organizations that are really helping us with this particular clinic and this overall effort. I've just met a whole wonderful team, and you'll see them in the background wearing the blue T-shirts that say "Through" on them, and it's the group from the Visiting Homemakers Association, and they are our healthcare partners, our principal healthcare partners for this clinic. So they're doing a lot of the things that are actually involved in administering the vaccines. And that includes 3 pharmacists, 16 nurses, 19 registration and checkout clerks, and 1 manager. What a contribution that is to this effort here at this particular arena. And then we have our community partners, and they're just as important in terms of that trust and that outreach that we're making out into different parts of the community. And when you hear their names, you will know that they come from and will be able to go back out to different parts of the community. The Somali Canadian Association, Delta Family Resource, Albion Neighbourhood Services, Rexdale Women's Centre, and Somali Women and Children. And between all of their efforts, they will be administering 500 to 700 vaccinations, which will bring us closer and closer. Every 500 to 700 gets us closer and closer to that target that gets us right up there where everyone is vaccinated. What we're doing is we as a team, and I say we very much in the collective sense, is breaking down every single barrier we can identify. And they don't necessarily fall exclusively under the heading of fear or hesitation or trust or accessibility. It's just anything we can do, including giving rides to people to get them to places like this to get vaccinated. That's what we're doing. And so I'm very much looking forward to the weekend's efforts and through into the week. I'll just name the neighborhoods that are part of this, so that if you happen to be watching television and you see your neighborhood mentioned, you'll know that you can reach out and take advantage of this opportunity. Elms, Old Rexdale, Kingsview Village, the Westway, Mount Dennis, Mount Olive, Silverstone, Jamestown, Weston, Black Creek, Humber, and Engle, Mount Lawrence. Those are the neighborhoods we're focused on, but my message is to every single person out there. If you're in the furthest east part of Scarborough, the furthest north part of North York, or the furthest west part of Etobicoke, or anywhere downtown, the message is the same. There are lots of places you can find at toronto.ca to get yourself vaccinated. And I want to just conclude again by saying thank you to my two colleagues, Joe Cressy, who's been a great leader in this as we've gone through the entire pandemic exercise, and Councillor Michael Ford, who stays so much on top of the needs and concerns of these neighbourhoods in this part of the city to make sure that when we put a program together like this, we're actually meeting what people say they need, as opposed to somebody downtown dreaming all this up and hoping for the best. So I want to thank them very much, and please get vaccinated. That's the important message for today. Now, do either of you want to say a word or two? Councillor Ford, please.
Well, thank you very much, Mayor. And you know what? The biggest stress here and what we've seen over the pandemic and what to stress today is to get in and get vaccinated. It's a full Team Toronto effort, and the Mayor has been tremendous throughout the entire pandemic for our community, and Councillor Cressy. And we just encourage you, this is a full Team Toronto effort this weekend, throughout the week, and to get in and get vaccinated. The incredible community partners that are in front of me and behind me here have done incredible work throughout this vaccination endeavor, and we thank you, because we wouldn't have come this far without you. But to our friends and families in North Etobicoke, come out, take this opportunity, and get vaccinated. It was just a few weeks ago, I was in one of these chairs getting my vaccination as well. So come out and take this opportunity.
Well, and I would just say to Torontonians right across the city, Torontonians are stepping up. It is remarkable to see the level of vaccine uptake in our city, and it is a real testament to each and every Torontonian from east to west and north to south who's protecting themselves, their community, and ultimately their city. This homestretch vaccine push that Mayor Tory outlined, this is our chance collectively together to reach everyone, everywhere. It is a hyper-local approach to bring vaccines to where people are, in the homes where they live, in the workplaces where they work, in the places of worship where they practice their faith, to the basketball courts where they play. This is a chance to bring vaccines directly to the people of our city to get those rates up. But this is a Team Toronto approach. That's not a tagline. It is simply a fact. The homestretch vaccine push is a result of Team Toronto, led by Mayor Tory and our city, Toronto Public Health, our hospital partners at Humber and Michael Garron and UHN, and community. Community-led partners on the ground, from community health centres to associations. Each and every resident in our city is doing their part, and all of these organizations together are going to bring this home. So to Torontonians, if you haven't got your first shot, do it today. And if you have your second shot in the fall, accelerate that appointment and get it tomorrow. And with that, I'll turn the floor back to Mayor Tory. Thank you.
Do you have any questions that have been sent your way? And okay, well, that's fine then. Well, thank you all very much. And thank you again to all the people that are doing all the work out here. It's fantastic. Thank you so much.